I'm Dr. Mahnaz Rashdi. I'm a periodontist and I practice in Beverly Hills, California. In today's video, I am going to answer to a question that I have been asked quite often on social media. Is teeth whitening safe? Well, there's no or yes answer to this question. Like any other procedure, there's always pros and cons to doing any procedure. But if you do it safely, if you do it conservatively, everything is okay. When you go out of the way to do your teeth so white that is going to obviously using very advanced and very aggressive type of bleach, those are not going to be kind to your teeth. For example, you are going to get in some cases you are going to end up having bone problem, bone loss problem, and recession and hypersensitivity and damages to your teeth and your gum and the underlying bone that there is no treatment available for it. I mean, it's going to be irreversible damages. But if you want to have a over-the-counter bleaching stuff that people use, such as those pens or those the strips that you can use, some of the toothpaste, those are safe to use as long as they are not super abrasive. You remember some people are using, for example, charcoal to put it on their teeth, and they use it with the toothbrush to causes whitening. Charcoals are very abrasive, and this abrasiveness, it will eventually cut your teeth and leave behind permanent damages that now you have to go and veneer your teeth or crown your teeth. So you have to be very careful about choosing what material you use. As long as it's like low percentage of hydrogen peroxide into the material that you use for your teeth whitening, as long as you're not using the percentage about 10 to 15% is safe. As long as you're not using this material every day is going to be okay. You have to, even if you want to use stuff like strips and toothpaste, don't make it like your weekly habit to use them. Maybe you can use it once, and then maybe the next few months you can, if you want to do a touch-up. The best way is that once you do the bleaching, try to avoid having food that they have colors like coffee, cranberry juice, Indian food. This type of food you want to avoid. Ketchup, tomato, berries, this type of food you want to avoid for at least a few days, because once you do the bleaching, there are tubules that they are on the surface of the enamel. They get widely open, and then they suck in any type of the colors that they exist in your food. So that's how you go back to what happened to my teeth, that they turn the same color. Avoid this type of food. Or when you have so much of this material, this type of food, like coffee drinkers or smokers or food with the color, make sure that you brush your teeth after so that you prolong the result of your bleaching. And good luck.